Hi, everybody. I'm Dr. James Goss, and I am the program coordinator for the Bachelor of Science in Healthcare Management here at MCPHS University. I want to quickly introduce myself to you. My background in healthcare management and leadership is somewhat extensive, having served in both the private sector as well as the public sector. I've worked for the federal government, state government, as well as county government. I'm retired from the Air Force, where I served, I retired after 20 years of service, but I spent the last 10 as a health services administrator and medical readiness officer. And I also spent 25 years thereabout with the U.S. Department of Health and Human Services Disaster Medical Assistance Team. And in that capacity, I spent 2 weeks at Ground Zero following 9/11 in 2001. I also spent 2 weeks in the South in response to Hurricane Katrina in 2005. And I ran a hospital in Haiti after its devastating earthquake in 2010. And we're going to talk a lot about the complexity of healthcare organizations. And I have to tell you that under those circumstances, complexity increases significantly. I've also had the privilege of working as a health manager for the healthcare agency in Orange County, California, and as a regional manager for a large corporation that runs ambulance services and emergency medicine groups. And while this sounds like I should be about 90 years of age, I'm not. But I think that this diversity of experience gives me a very unique perspective on the complexities of healthcare management, and which is one of the reasons there are healthcare management programs specifically dedicated to educating managers for the healthcare industry, because the healthcare industry is incredibly unique, and being educated for management and leadership within such a complex system truly prepares you to lead in any other system. And so this brings me to the importance of the programs such as this one. There was a management guru named Peter Drucker, and he was extremely well respected across all management organizations. And he characterized healthcare organizations as and I'll read it, the most complex human organization ever devised. And I have to tell you that people who manage institutions, particularly hospitals, agree with this characterization. And he said this about 20 years ago. And nothing really has changed in those 20 years, except maybe the fact that it's become more complex. And I assure you that it has actually become more complex, so complex that professional organizations such as the American College of Healthcare Executives and others repeatedly assert that standard management education programs are not ideal for healthcare leaders, and that effective healthcare leaders require healthcare-specific management education. And this is true whether you're in an early careerist, a mid-careerist, or late careerist. Education and the complexities of managing and leading healthcare organizations is key to your success. You need exposure to the management challenges and the best practices that are needed to run successful healthcare organizations. I should add, and it's probably one of the most important things for you to know, is that an ability to manage and lead in complex adaptive systems such as healthcare organizations is easily transferable to any other industry, but that's not true the other way around. So a person who is capable of successfully running a complex healthcare organization can easily run other organizations outside of the healthcare industry. But just because you're successful at some business outside of the healthcare industry does not mean that you're going to be able to transfer that to healthcare. And I think that's probably one of the more important things that I can say to you regarding this education. Now, the MCPHS University School of Healthcare Business was established in 2018 as a way of acknowledging the competencies demanded of successful healthcare leaders. It equips graduates with an understanding of healthcare systems and processes and business competencies that are unique to healthcare. So Another very important fact is that you'll be starting your education at a very historic time and a very important time where pressures on the healthcare system are increasing, not just because of the pressures put on by the pandemic, but also because there are political pressures, and we are attempting to address health disparities, and there's increased globalization in healthcare. So, in fact, I want to say that according to the Department of Labor, health services management roles are expected to grow by more than 20% in the next several years, which is much faster than the average for other professions. And these jobs are widely considered to be recession-proof. Now, is there going to be restructuring within the healthcare industry as a result of these pressures? Yes, but the demands for healthcare managers will continue to increase. And I should probably add as well that our programs prepare you to take leadership roles in administrative and clinical practice, as well as practice globally. In fact, I would say that physicians and many other licensed clinical professionals who want to go into healthcare management often recognize the need to go back to school in order to develop their competencies within themselves. So our programs empower our students through a unique combination of classroom and face-to-face experiential education. And this is incredibly important because the communication, relationships development, and leadership skills that are essential to the success of healthcare managers is best developed through a combination of didactic and experiential learning. To top it off, the faculty have loads of real-world experience here at MCPHS. The blending of our didactic education with a structured experiential learning experience during your formal academic education leads you to be a more highly skilled and fully developed professional. Our students have completed structured internships in a variety of healthcare organizations, from hospitals to pharmaceutical industries. And just some examples include Brigham and Women's Hospital, Pathfinders, the Institute for Justice and Democracy in Haiti, the National Organization for Rare Disease, NeuroCare, North Shore Medical Center, and Partners, which is now known as Mass General Brigham. And this is to only name a few locations where our students have gained that experiential learning. These learning experiences allow application of what you learn in the classroom to the real-world environment, and also serve to help you broaden your professional network over time, which is critical. Additionally, your faculty bring real-world examples into the classroom and walk you through valuable learning cases. You'll have broad exposure across the spectrum of healthcare, from pharmaceutical to research companies, managed care, medical device and life science firms, consulting firms, healthcare technology, nonprofit organizations. The BS in Healthcare Management curriculum has been carefully designed to develop the competencies that are necessary for success in healthcare and any people-centered organization. And this includes the very important general education core, survey courses that introduce you to various healthcare sectors and organizational concepts, business courses that focus on key issues and concepts, concentration and elective courses, and career core and experiential coursework focused on the key competencies and demand across the healthcare sector. Now, I've used the term competencies a number of times, and just to explain what they are, competencies are the knowledge, skills, and abilities that transcend unique organizational settings and are applicable across the healthcare environment, whether it's at a hospital, pharmaceutical or medical device agency, or organization, or medical technology. And so this program prepares you to work in any number of areas. And so we've included some of those areas here on this slide. So whether it's a hospital, such as patient administration or clinic leadership, a pharmaceutical organization, such as sales or marketing or business development, very importantly, project management, or it's careers in technology, such as medtech, medical software and coding, or consumer health informatics. These competencies are generalizable across the spectrum of healthcare organizations. So what makes MCPHS unique? Well, some of the things identified on this slide are exactly why I turned down a faculty position at another university. This university is so committed to your success, to student success, that it becomes more attractive to faculty as well. It's not just the combination of didactic and experiential education, but they also put focus on faculty mentors such as myself, or academic coaches, and also the location provides itself and creates opportunity for students to experience some of the most advanced health systems that are the envy of the world. And also there's cross-registration available to the colleges through the colleges of the Fenway, and MCPHS has a very unique Advantage Scholarship program. And this just identifies a few things of what makes MCPHS unique. So I want to conclude with this. Why MCPHS? It's also probably the number one reason why I chose this faculty position over other faculty positions, because this university is number one in the country for earning power. It's number 3 for return on investment when compared or measured against 4,500 other colleges and universities. That's even higher than Harvard and other very well recognized universities. And our location, like we mentioned earlier, the Longwood medical area, and also because of there's opportunity for collaborative practice. Interprofessional education experiences allow students to collaborate across healthcare fields to reinforce today's team-based approach to patient care. The healthcare organizations are a team of teams, and it requires unique competencies in order to be an effective healthcare leader. So I really want to thank you for your time. And I truly hope that you will choose MCPHS, and I hope that you'll choose this program. And I hope to see you someday on campus. Thank you.